Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, and I'm here to follow up on what I've been saying all week about mask use here in the United States. Things have changed so much from us being told not to wear masks, it's ridiculous, to being told that by the head of the Chinese Center for Disease Control and Prevention that the United States and Europe are making a big mistake by avoiding the use of masks by the general public out in the community, whether you have symptoms or not, to now a new development today. So let's just see if we can get some other folks in the room before we get started. I don't want too many people to be behind. And so, hey to Jarvis, thanks for joining. Thanks so much for joining. So yeah, we'll just see what's going on. And in case you don't know who I am, I'm Dr. Kadisha, your board certified emergency medicine physician and author of the best-selling book, Help Us Help You in the Emergency Room. I have to tell you, it's Friday evening, and this is often when the ERs start to fill up because the primary care doctors' offices are closing or have closed already. The urgent cares might have limited hours. I am seeing here in Houston that a number of urgent cares have limited hours due to the COVID-19 situation because more people are going to hospitals or more people are actually staying home. And unfortunately, a lot of people are afraid to go to the hospital, even though they might have legitimate health concerns because they're afraid of catching the coronavirus in the hospitals. But either way, the ERs are getting busier and busier as we speak because it's Friday night. And the resources are slimming down to just the ER because we're the ones that are here for you 24/7, day, night, weekends, holidays. The ER physicians and staff are here for the general public all the time. Now, speaking of times to go to the ER, again, I want to refer to this book, Help Us Help You in the Emergency Room. This is my book, and it's inspired by 20 years of questions, complaints, and concerns by people like yourself about the ER. Anytime someone hears that I'm an emergency medicine physician, I get cornered and told of some story of a nightmare that someone had in the ER, of delays, saying that they didn't understand what was being explained to them. I'm being told that they left the ER not knowing what was wrong with them, and just things like that. But back to Friday evenings in the ER. One of the many points of advice that I provide in this book is, one, know the best time to come to the ER. When is the best time to come to the ER? Hey, Dr. Dietrich, thanks for joining me. Dr. Dietrich is America's relaxation doctor. She helps us realize and recognize how to relax at work so that we can be more productive and less stressed on the job. She has a book. She's got products. She's got everything. Definitely go check her out. Put your website in the chat for us, Dr. Dietrich, because even though we're working from home, there's still work-related stress that folks are experiencing. So back to Help Us Help You in the ER. Right now is probably one of the worst times to go to the emergency room, but if you have to go, and maybe download the e-version of this book on Amazon so that you have at your fingertips helpful advice to help you better navigate your ER visit. You might actually get to sidestep some of the delays and frustrations that make so many people dread the ER, but anybody could need the ER at any moment. So that's why everybody needs this book. So anyway, back to the best time to come to the ER. Okay, so I'll just read a little bit here while we wait for some other folks to come in. The best time to come to the ER. If you feel your condition can wait for the least busy time to go to the ER, go early in the morning, between 4 and 9 o'clock a.m. One poll found that between 6 a.m. and noon is best, but by noon it's usually pretty busy, and that is true. Oftentimes, ERs if we have multiple doctors working, we have a doctor come on at like 6 or 7 a.m., and then we have another doctor come on at like, say 9, 10, or 11, because by noon, things are really jumping. So that's, really the best time to come is like around those times. And also another valuable piece of advice that you're probably not going to find in writing anywhere else is this: to have nurses and doctors at their best, come shortly after 7:30 a.m. or 7:30 p.m. as new rested doctors and nurses usually come in at 7, either 7 in the morning or 7 at night, and they need a little time to get report on the patients who are already in the emergency room. So now do you see some the good advice, an example of the good advice that you could get from this book? This book has that piece of information and more. It has this much information in it and tons of pictures. So, I tried to make it as entertaining as possible, and it also has some pages in here where you can write your own information about your symptoms, about what we're looking for when we ask you what brought you to the ER, about your meds, allergies, procedures. This way, it'll also jog your memory while you're waiting to be seen. Because sometimes people will tell the nurse, what they remember from their history, but then when the doctor comes, they might remember something else because the nurse asking them the first time jogged their memory. Okay, so thank you, Dr. Dietrich, for putting that in the chat. So yeah, definitely get this book at www.helpushelpyoubook.com, or you can look up the title on Amazon, and download the e-version right to your phone. Okay, so we're talking about the mask use today, and I remember, Dr. Dietrich, during our discussion on perspectives in primary care, someone had asked if the homemade masks were effective, or should even be used, are they protective, should we even bother? And our Center for Disease Control and Prevention has released new guidelines today recommending that people in the U.S. wear the homemade face coverings to prevent the spread of the novel coronavirus. So, yes, the CDC is additionally advising simple cloth coverings to help people who may have the virus and do not know it, to keep from transmitting it to others. And this was said by our United States Surgeon General, Jerome Adams, in the press conference at the White House today. So, and if you want to know what he looks like, go on Google, or you can go to my Instagram website. That's Dr. Kadisha, MD, DrKadisha, MD, and I put some of the pictures of the major players in my Instagram feed. Check that out. So, and we know in January, when cases of COVID-19 were first reported in the U.S., the CDC said that only healthcare providers and people who are acutely ill should wear the face mask. Health providers were to use surgical masks and N95 respirators, which filter out tiny particles in the air to protect themselves when working closely with sick patients. Yes. And, we were told to, if you're not in that environment and you don't have symptoms, you don't need to wear a mask. And that the respiratory droplets only should travel at most like 6 feet before they fall to the ground. But now, new information, new research is showing that that the virus can linger in the air just from talking, just from regular breathing, and that it may linger in the air longer than we thought. So, yeah, just speaking or breathing. So, and this is why I think I started seeing it last night on CNN that the White House Task Force and the CDC, they've been reevaluating their mask recommendations over the past few days. But I think, Dr. Dietrich, when was our last episode of Perspectives in Primary Care? It was sometime this week. And, the three of us, Dr. Dietrich, Dr. Carol, and I, we discussed the new normal. And in that discussion was a discussion of masks. But, and we were discussing that based on research that shows that people without symptoms can infect others, and that the virus may spread when people speak or breathe, not just when they cough or sneeze. So in the light of this new evidence, the CDC is recommending, and the task force, the White House Task Force, also recommends people wear cloth face coverings in public settings where other distancing measurements are difficult to maintain. And boy, do I know that. Yes, the normal flu also lingers in the air as well. Because I'll just say, because we're still allowed to leave the house for essential tasks like going to the drugstore, the grocery store, things like that. And some people, I'm telling you, a lot of people aren't wearing masks, and a lot of people, because we're often standing in line at the drugstore, standing in line at the grocery store, standing in line at the bank, and some people aren't, they're not concerned. They will be definitely within 6 feet of you, and and they just don't seem concerned. If they think if someone has no symptoms, they don't think about the social distancing. And honestly, I had started wearing masks even before this recommendation because of that. They've been saying that people who have no symptoms could possibly spread the virus. They started saying that with the young people. The young people may have no symptoms and spread the virus to our elderly folks, or even young people who have health conditions. There are younger and younger people who are becoming very ill with the coronavirus infections, just because, and you can't feel that your youth is like a force field or something like that against a serious infection. And for those people who think that, and I'm hearing this more and more, even Anderson Cooper said last night on CNN that initially he was thinking, wouldn't it just be good just to get it and get it over with? Just get the infection and get it over with. And he said that his doctor told him, don't be ridiculous, because you have no idea how you will fare as an individual should you get infected. So even if you're young and you feel like you're healthy and all of that, don't take the chance of becoming infected because you think that you'll recover at home. An emergency medicine physician died this week because he thought he could recover at home. He thought he could handle it. Anderson Cooper thought the same thing, maybe I'll just get it and, just get it over with. And you can't do that. You cannot do that. He and Sanjay Gupta interviewed the brother of the governor of New York, who is at home getting over, or he looked pretty good, but he's got the coronavirus infection also. He looks great. He looks like he's a very healthy looking man, but he said that, even though I'm fighting it and I'm healthy, I'm in good shape, this infection it will break you down. It is not easy. You could be, struggling to breathe for 2 weeks, fighting fever for 2 weeks. So don't take a chance with getting it. Definitely practice social distancing. I say 6 feet apart, follow these guidelines, wear the mask. Now they're officially saying that the homemade masks are better than nothing, and at the least they protect other people from your respiratory droplets. You don't want to contribute to the spread of this. You don't want to contribute to the prolonged stay-at-home or shelter-in-place recommendations, for the entire country or state where you live. So, does anybody have any questions or comments? I would really love for people to express any concerns, put any other comments in the chat. So, but yes, the flu can linger in the air. Also, another problem with the flu is that people can spread it without having symptoms. You can be infected with the flu virus and really not feel that bad for a few days. You could have it for a few days and before you feel bad, and by then you've been to the grocery store, the bank, the movies, the drugstore, and could have given it to countless people by the time you actually sit yourself down and stay home due to your own symptoms. Okay, so what the CDC is saying is that if people cover their faces with a cloth mask or another barrier, it may blunt the amount of virus-laden particles they release. Now, there is limited evidence that these types of makeshift masks prevent the spread of disease, but some research shows that they do reduce the amount of particles a person wearing these things can spread. Some experts say they're better than nothing, and I agree, they're better than nothing. And the CDC is saying still, don't fall into a false sense of security because you're having the mask. Continue to stay 6 feet apart when in public as much as possible, even if wearing masks. So let's see if there's anything else in the comments. And and if you're watching this after the live is over, type in #replay, and you can still comment, and I'll see that and respond to you on my Facebook page. And you can also discuss other topics that you would like me to discuss. So yeah, definitely either now during the live or after the live is over and you're watching this, type in #replay. Also, this is also Oral Cancer Awareness Month. And you'll also see that I mentioned this on my Instagram also, where I say that, while, smoking and chewing tobacco do increase our risk for oral cancer, there is another growing demographic in the oral cancer population, and it's young, healthy, non-smoking individuals who are coming up with oral cancer due to exposure to HPV. And HPV is the most common sexually transmitted disease. So you know how you might get that. So that's another thing to consider. Okay, so Oral Cancer Awareness Month. We'll talk about sarcoidosis next week, because this is also Sarcoidosis Awareness Month. And one very dearly departed person that I think people still miss today, Bernie Mac, he died of complications of sarcoidosis also. So definitely mention him on my Instagram account next week, as I did with Prodigy from Mos Def for sickle cell anemia, and Michael Jackson for sleep awareness. So DeJarvis asks, if you've been around someone who was recently diagnosed with the coronavirus, would taking a multivitamin or zinc help? Excuse me. I thought I was going to sneeze. Yeah, yes I am. No, I'm not. I mean, taking a vitamin and zinc, those things do help boost your immunity, but they may not, they are not expected to, stave off the coronavirus. They might help your immunity as far as your recovery from an infection. And, those are some things that we should be taking on a daily basis, multivitamins, zinc, things like that to boost immunity, but it's not going to, protect, or like stave off the coronavirus infection. Those are things, but yeah, that's a good question. There are definitely things that we should be taking, especially during cold and flu, and now this is cold, flu, coronavirus season. Definitely things that we should be taking. Okay, so guys, I just want to, I know I've been on here long enough. I think I've been on here, about 28 minutes now. So yeah, guys, so didn't want to keep you here too long, but yeah, so now the CDC is recommending that we wear masks, even if you don't have the N95s or the surgical masks. Those things are getting they're extremely scarce on Amazon, and the people who do have them they're charging very high prices for individual masks. They're even charging first responders high prices for the masks. Do not despair. The CDC does say that the homemade or cloth masks are better than nothing. Even if it just keeps you from infecting other people with the coronavirus, flu, other viruses that cause the common cold, it's still good to wear the masks of any kind. Don't feel bad about not being able to get the surgical or N95s. And, and they at the very, very least help protect your mouth and your nose should you touch an infected surface and accidentally brush against your mouth or nose. So now I should expect to see more people wearing masks out in public of all kinds, surgical, cloth, do-it-yourself masks, even the N95s if you have them. So, and we're still washing our hands for 20 seconds at a time. Count up to 20 Mississippi, 1 Mississippi, 2 Mississippi, on up to 20 Mississippi, or sing the happy birthday song twice. But wash your hands with soap and warm water for 20 seconds. Use hand sanitizer if soap and water is not available. When you're going out running errands, have your own pen, because I'm seeing many opportunities to catch things when folks hand you their pen. People aren't thinking about that at the banks, food delivery, at the grocery store. Have your own pen so that you don't have to, getting carry out, have your own pen so that you don't have to touch other people's pens, because people still aren't thinking about that. Like, they're handing you pens to, sign your receipts and everything. Then they take it back, hand it to the next person, take it back, hand it to the next person. Have your own pen, sanitizer, and any kind of mask that you have to help so that we can help get on top of this virus. Still practice social distancing, 6 feet apart. I wouldn't even count on the 3 feet, but at the very least 3 feet, but 6 feet apart also. So again, I'm Dr. Kadisha. I'm your board certified emergency medicine physician, author of the book, Help Us Help You in the Emergency Room. The need for this book on Friday evenings is greater than it is even every other day. Get this online at www.helpushelpyoubook.com. Go to my website, www.drkadishamd.com, for that freebie titled 8 Essentials for Surviving a Medical Emergency. If you sign up for that, if you get that, then you'll get daily emails from me, weekly blogs from me as well. And follow me on Instagram, Twitter, and hopefully you're following me here on Facebook at Dr. Kadisha MD. That's DRKADISHAMD. And on Instagram, it's Dr_Kadisha_MD, because people were having a hard time seeing the letters. But yeah, definitely check me out. Follow me for daily affirmations, weekly blogs. And people say that my Instagram is awesome and my following is growing. So I guess that's proof that it's good. And it's fueling me to continue the work on my Instagram account. So, and I thank you for joining me. Be safe, wash your hands, stay 6 feet apart. Don't feel bad about not having the medical grade mask. Even the do-it-yourself or cloth masks will help you. Hey, Cedric, thanks for joining me. And yeah, check out his Facebook page, The Conscious Mindset. He and I and another great ER doctor in Houston, we also did a discussion of the coronavirus on March 22nd. And yeah, guys, so yeah, check us out, follow us, check out Dr. Dietrich, America's Relaxation Doctor, on her page, drdietrichg.com. Check out Cedric at The Conscious Mindset on Facebook, and go to my website, drkadishamd.com, for the freebie. Bye.